Today on the show, we're talking about natural memory boosting and the prevention of cognitive decline. Welcome to the DAMY vlog. My name is Dr. David Duizer. I'm a naturopathic doctor and the medical director at damyhealth.com. Thank you so much for tuning in. On this show, we talk about all things holistic health and wellness related. Today, we're talking about cognitive decline, dementia, and in general, natural remedies to boost memory. The reason this is important, with an aging population, we need to be focused on the prevention of dementia. Dementia is a nightmare for those who have been afflicted and their families. And we think that it's most likely a metabolic disease that we can actively attempt to prevent. In the prevention of dementia and in working towards a healthy cognitive output long term, we need to be thinking about general metabolism, nutrient absorption, stress, hormone function. We need to be thinking about all of these things. We need to be thinking about blood flow to the brain. We need to be thinking about a series of associated factors, associated risk factors that we can be actively attempting to optimize in order to then prevent the onset of dementia. Now, the reason I want to speak about this today, at damyhealth.com we focus on the holistic approach to weight loss, and the reason we love this approach is because it is healthy and has multiple effects on the body in the sense that it can be very, very good for other organs, specifically the brain. When you're a healthy weight, we know brain function is better. Today I want to talk about belly fat. Having an increased abdominal obesity predicts long-term mental decline or cognitive decline. People who have abdominal or visceral fat, deep belly fat, tend to experience worsening cognitive decline and therefore are at an increased risk of dementia. Now, why do we think this is happening? Well, guess what? When you have abdominal obesity, when you have belly fat, it's making inflammatory cytokines. It's making inflammation. We know that when there is increased adiposity in the abdomen or increased fat cells in the abdomen, IL-6 goes up. And IL-6 is an inflammatory cytokine that correlates really well to CRP, a marker of inflammation in the blood. When CRP is high, the risk of diabetes is high, the risk of cardiovascular disease is high, and of course, the risk of dementia is high. So in the prevention of dementia, we want to keep CRP down. But in order to do that, we have to be thinking about IL-6 and therefore belly fat. So we know that increased waist-hip ratio or increased adiposity or weight around the waist is associated with cognitive decline. We think the mechanism is probably inflammation. So as a way to suppress inflammation and keep the brain healthy long term, we need to be reducing abdominal obesity. We need to be exercising and eating low calories and then attempting a holistic approach to weight loss. So in doing this, what do we need to be thinking about? Well, we know that abdominal obesity or adiposity in the mid-range is associated with insulin resistance. It's associated with increased insulin output and therefore increased carbohydrate intake. So when we consume carbohydrates, our pancreas secretes insulin. When insulin goes up, we tend to put on fat around the belly. Now, how can we mitigate this? Well, number one, we need to be exercising. We need to be circulating blood. This is also just really good for the brain in general. It's also really good as an anti-inflammatory. So regardless of what inflammatory molecules are being made, exercise can suppress. But it's also really good for metabolic function. Also, we need to be thinking about reduced caloric intake, specifically those calories coming from carbohydrates, especially from simple sugars. No simple sugars when we're trying to regulate insulin secretion and reduce belly fat in general. And then we also need to be thinking about other ways of mitigating that blood sugar, glucose control, and insulin spikes. So we need to be consuming cinnamon, and we probably should be thinking about alpha lipoic acid and berberine, for example. These are therapies we use to reduce the negative effects of poor glucose control and improve insulin secretion and insulin sensitivity at a cellular level. So increase your body's ability to pull in glucose without secreting a ton of insulin all the time. The drug we use here is metformin, which is not a bad drug, Berberine is pretty good as well as as an extract from herbs that does a similar function using a different mechanism. In naturopathic medicine, we like to use both metformin and berberine, especially if someone already has a diagnosis of diabetes. So my point in saying this is to improve brain function. Yes, we need to be stimulating blood flow to the brain, and therapies we use to facilitate that are things like lion's mane mushroom, and B vitamins can be helpful. Acetyl L-carnitine can be good, but vinpocetine and huperzine A and alpha GPC or choline, we use these things to improve synaptic function in the brain, to improve blood flow to the brain, in addition to exercise and proper sleep and keeping stress low and all of these other factors. We try to facilitate nutrient absorption, make sure nutrient status is met through diet. And then we focus on adiposity around the mid-range. We try to reduce belly fat in general. So there are some markers we like to look at here. We like to look at CRP, we like to look at fasting insulin, we'll look at A1C, which is a measure of blood sugar control over 3 months. We'll look at all of these factors. Sometimes we have looked at IL-6 before in this clinic, but really we're just thinking about reducing waist-hip ratio, keeping belly fat down to prevent cognitive decline. This is one of the keys in improving memory long-term and keeping our population healthy as we move through the generations here. We need to be thinking about ways to mitigate ways to reduce the risk of cognitive decline, because dementia is going to hit our population hard here in North America, and we need to get ahead of it. One of those ways, reducing belly fat. The way to reduce belly fat, the holistic approach to weight loss, and the holistic approach to insulin sensitization, or improving glucose control through living a healthy lifestyle. That's my show for today. Thank you so much for watching. Hope you enjoyed this show. If you have improved your glucose control, if you have found natural ways to improve insulin sensitization, share them in the comments below. We'd love to hear your story. If you have seen benefits to your mental capacity, your cognitive capacity, through the use of, say, lion's mane or B12, alpha GPC or choline, vinpocetine, huperzine A, if you've taken a nootropic in general, share them in the comments below. We'd love to hear your story. Thanks for watching. Hope you've had a great day and hope you find value in our videos here. If there's a topic you'd like me to discuss, share it in the comments below, and we'll do a deep dive into your topic. Thanks for watching. Have a great day.